My name's Elizabeth, and I'm with Mercury Medical. Thanks for coming today. I'm going to be doing the in-service training for the FlowSafe 2 Plus for you guys. Now it's pretty straightforward as far as how to use it, and I think Leslie's going to pass out your policy that you're implementing. She's editing it right now to kind of go live when you guys do that this month. But so it comes shipped like this, so it's pretty simple. They say it's fire safe proof, but anyways, it's just 2 components, so you can't really put it together wrong or incorrectly. So you have your O2 tubing that will hook to your E or H cylinder, whatever you guys have on your rigs. And attached to that tubing, there is like a little cheat sheet. You're always going to want to start out in CPAP mode, depending on what your patient needs. You can do a bi-level mode as well. Are you guys familiar with bi-level for transport?
We're working on it.
Okay, all right. So bi-level just means basically they're providing an inspiratory and an expiratory pressure, so helping them do more of the work. But for your patient base that needs this, like your hypercapnic patients and whatnot, any CPAP, it's nice because you're getting a device that can do 2 things. So kind of depending on your patient needs, and if they're over breathing it in the bi-level, you can switch it back to the CPAP mode, which is right here at the end. But to give a neb treatment, it's always going to have to be in CPAP mode. So I would just always start out in that. It's a good rule of thumb. So, and again, the patient's not in distress, so you do have time to kind of talk them through. Hey, this is going to help you do the work, and it's going to help your oxygenation and stuff go up. So if they don't feel comfortable with just putting this on like their head and putting down the straps like that, you don't have to do that. You can just hold it up to your face or to their face. They can get a tight seal, that way above the bridge of the nose and under the chin. The next thing you want to do is just look at the manometer right here and make sure that registers their breath, because in order for the device to calibrate, it needs to get a reading of what their breath is. So you want to make sure that needle doesn't go below the 5 o'clock position there. And I think the flow setting should be 10 liters or 8 liters per minute. But I'm not sure, so we'll just have to look at the policy on that. But depending on what your patient needs, you can always look at this little blue thing here as well. So it's pretty straightforward that way. Do we have any cylinders to try it?
I'll get them.
And it's single use, so just one patient. And you guys are ordered 2 different part numbers, so the 2 different sizes, and it'll fit 85% of your patient population. And then there's a larger size for the larger patients, for the other 8 to 10% that you have.
Where do the nibs hook into this?
So it's just a standard T-piece fitting that you would fit into
Okay, so
this. Yeah, yep. And I think like Boundtree sells them or whatnot, but it's just a standard fitting. And they do, if you guys are using them like in the Hamilton V60s, they do have a valve that you can hook up to the V60s. Do you guys have those on the rigs? No. Okay. They have it more for transport, I think.
Yeah, they may have, but we don't.
But I haven't had any problems with temperature control as far as keeping them in the car and stuff. But obviously, you don't want to have them in high temperatures, just for certain reasons, because it's plastic and stuff like that. take this part off, right? And then
Yes.
we're going that way.
Maybe. You gotta hold it really hard.
Or can I just set this on the floor?
You may do whatever you like. Within reason.
You just pulled it.
It was for you.
Does anyone want to try it? You would use your like nasal cannula on your end too, so you can still do your capnography and stuff as you would normally. I haven't heard anyone have, any issues with this, with having the nasal cannula too, so.
Oh.
I'm not familiar with this tote, so I'm not sure how to turn it on. Oh, okay, here we go.
Okay. Sorry.
Let's not even do anything, because I don't have it on. Does anyone want to
I'm coming.
put it on?
Kelly will put it on.
No, I'm not putting it.
But you walked up there. She was looking for volunteers.
I'm waiting.
Yeah.
No, she said she was trying to turn it on.
Oh.
There you go.
Absolutely.
And I would start at 8 and you can adjust it to 10.
What's the max we should put it on?
I don't want to go through your tank either.
We know where they are, they'll make one.
I don't want to put it on myself.
Oh, you don't trust your product?
No, I do. I definitely do. That's why I don't, because I know I'm healthy, I have good lungs. I'm not sick, so you can definitely overbreathe it.
Beaman, don't you want to try it?
I'm allergic to air.
But you can hear though, it's not as noisy as probably the pull down device that you guys are currently using. It's not
They got one big enough for my head.
noisy though.
That'll fit your head.
Just try it. It'll fit your head.
Knock your hat on,
She's
please.
got one up there. Go up there with the hair. Hey, go up there with her. She's got one.
Yeah, you can put this one. You don't have to put this on.
You can just hold it. You don't even have to mess your hair up.
We're putting it on when?
Let's
You got any
do
nitro?
this.
Nitro.
Nitro.
Yeah, that ain't going back there. Okay.
Okay. But you can just hold it like that.
Yeah, I got a massive behind you.
I'm gonna turn it up to, let's do 6 for now. See, I got a clear reading there on the agreementometer. 20/5, which is good. Now let's switch it to bilevel. See what we can. Can you tell the difference? Is it more pressure? Let's put it on 10. Now I'm getting 7. Which one's more comfortable? CPAP or bilevel? Bilevel. So it depends on, I guess, what your patient needs.
Yeah, I mean, that's interesting.
I mean, we don't recommend it, just because it doesn't, we've tried it with other masks and it doesn't have that good seal that that one provides. Those are adjustable to the forehead.
Yeah, I was concerned about them breaking right there.
So they don't break like the ones that we have now. Dr. Wells actually put one in the trunk of his car with a whole like thing of water bottles in the back. And it sloshed around and rolled around back there for a couple of weeks and it didn't break it off.
But did you get rolled up by a paramedic putting back?
Yeah, I mean,
Well, I mean, it seems a little bit more durable than.
Yeah, it's a lot more durable.
yeah.
And it is, yeah, that you can adjust based on how their head is
Oh, that's
shaped
nice
and
too.
everything.
That's
To
nice.
have a better fit, yeah.
That's more reason why.
And we'll have the medium and the large mask.
Yeah.
I say the medium should fit about 85% of the patient population, but you guys got 8 boxes of the large ones, so we'll see how long that'll last you guys.
We got a lot of large patients.
Oh, you do?
Thanks, Colin.
Compliment.
I'm healthy.
Exactly.
You guys are gonna go live with it this month, I think, to start using it?
As soon as we get everyone trained,
Everyone,
yeah.
Okay.
Yeah, so we'll start pushing the training out to all of our crews, and once we get all of that done, then yeah, we'll
It's a
go
little bit
live.
from the bi-level.
It is.
Does the hospital, do you have to go pick them up from there?
They bring them to us.
Oh, they do.
So it's on the hospital template, so when we make our order, they bring all of our stuff to us.
It's all-
Yes, it's very nice.
So now we're gonna attach the, duonet to it, or a nebulizer.
Yeah, you wanna, do that? I just need like a standard T-piece fitting. Remember, it has to be in a CPAP mode to do that,
I
so.
have three different.
Maybe you guys noticed there's this nice little cheat sheet sticker on here that tells you for BiPAP or for CPAP what your oxygen setting should theoretically be based on what you're going to want your bilevel or CPAP settings to be.
Or I mean, ultimately, we should monitor the speedometer, right?
She said T,
Manometer.
not
Manometer.
comp. She said T, not elbow.
You said what?
She said T, not elbow.
So this would be
Come
where
in
you
as
should
well.
like set your stuff up to get what you would need.
You have your sheets.
You're gonna put that on YouTube? Okay. Thanks.
How would this work? Because I haven't used this one. This should just be standard.
Will this thing go into the bottom of the T?
What's that? This?
Yeah, which part will this go into?
Yeah, so that goes on that side, and there should be an elbow to connect to the bottom side of the T.
Either that or we need the squishy blue thing.
This blue adapter.
Squishy blue thing.
Let's see.
Might as well go ahead and grab the Lexi strap too.
Yeah, well, I said elbow. I got to know.
I do like how you can control the flow though, and you don't have to, it's not just wide open all the time. So you're not gonna have your tanks as fast. Yeah.
It's more complicated than the other CPAP nebulizer.
Just keep on putting pieces and parts together until it works, right?
That's pretty neat.
That would make me more happy.
Maybe, perhaps, we don't know.
But you're gonna have that bottom piece covered. You can't have that open T.
Yep.
Just use your thumb.
I don't think that's gonna work. The one I used, was from Boundary. Before.
You get what I was trying to say, right?
Yeah.
Okay, cool.
I got you. It's like it's,
Is our YouTube account monetized?
Can I have a look?
So I can say whatever I
That
want.
doesn't hook to that.
Let's see if it goes.
I think we can edit some like elevator music in there.
Do what?
what'd you say, we need elevator music?
I said we can edit it into the video.
Oh.
I'm not that.
We gotta
we
maximize our
can
social
not.
media presence, man.
Right.
I was gonna say, do the blue to the,
Is that going down?
It's a good thing we're not treating a patient.
I'm not sure.
That works.
Let me see, I know we have a part number that quote, so that's, doesn't help, they don't.
There you go.
have it here.
All you need is the T and the blue piece.
That's it. So you just want to make sure it's in CPAP mode instead of bi-level. So start with CPAP to give a neb treatment, and then turn on your O2 and put it up to the patient's face that way. But it has to stay in the CPAP mode to give the neb treatment.
we should probably take a picture of that. Just-
Yeah.
Mhm.
It's a oxygen for the neb to that, yes. Yeah.
Two tanks.
Pretty much just this.
It's pretty straightforward. That's all I really have for you guys, unless you have questions.
Blue wheel?
For, let's see. So you don't adjust that. That's just kind of like the components. That's working and moving the needle and stuff like that.
Okay.
So that changes like when you're doing your bi-level and your CPAP.
I mean, that blue wheel at top would be expiratory pressure, right?
IPAP, yeah, and then CPAP is your continued positive airway pressure.
That says EPAP.
Was that expiratory?
Right,
Your
so
eye is
you would adjust that to your
inspiratory.
patient, right?
Mhm. Yes.
That's definitely something that we would touch.
No, you wouldn't want to touch this dial, no. Anytime you're moving it would be CPAP or bi-level. You don't want to touch that blue dial.
This one?
I mean, you can touch
We
it,
will
but-
adjust that so that it makes sure.
Right.
Once you set it on CPAP and you switch them over to IPAP, whatever, your reading is on CPAP and it's working well and you move them to IPAP, then you may have to adjust this so it's appropriate.
Okay.
So then you would adjust it so that it stays the same reading. so
Once it's in
appropriate. Yeah.
BiPAP phase, right? Okay.
Yeah.
But you want to look at the manometer to get a visual of the reading too, so that's kind of why you have that.
Is there any like magic number we're shooting to aim for on this one?
Yes. So if you're using it like for your COPD, you know, right now it's already 3 to 5.
Yeah.
And then if it's for your CHF, 7, and then you're drowning and near drowning is 10. So we're gonna go with the
You're
same
welcome.
thing as of right now, unless Dr. Wells decides to change that.
Oh, shit.
Back up with it just a little bit for me.
What
It's a
number are you
status
starting
focus.
at?
Yeah.
It depends on what we're using it for.
Okay.
As far as, you know, the asthma, COPD, CHF, or drowning, near drowning.
I would say just adhere to your policy on that one, because I can't speak on it.
Does anybody want to see this?
I can take a picture. Should probably try to figure it out with the orange ones too.